Well, there's breakthrough technology that is breaking barriers in breast cancer prevention. And here to tell us about this test and prevention method is Dr. Indira Pooler and Dr. John Gillespie. So welcome to both of you. Thank you for taking time out of your busy schedule to tell us about this exciting new test for breast cancer prevention. Clearly, I have no medical background, so talk to us about this new test.
Thank you for having us.
Thank you.
The test is for women who have breast masses, and the mass is called hyperplasia.
Hyperplasia.
And the test is for these people to, for prevention, in the sense we have preventative therapies available, but we do not know who we have to give the therapies right now. So our test can tell who is at high risk.
Okay.
And so we give only to the high risk patients, not to those who are at low risk.
And what is the test called?
Our new test, it's called a BBDRisk Dx.
Okay.
And it's a genomic test that will determine the risk that a woman who has been diagnosed with breast hyperplasia will develop cancer in the future.
Wow.
And it's actually a score. And so the decision will be made between the patient and her doctor with the number to know whether she should be treated or not treated, or just have watchful waiting.
And how long, I mean, in the making is this test? I mean, this seems there's nothing else like it, correct?
No, it has taken us more than 10 years to develop this test.
Wow. And so this is, I mean, this is probably going to help save so many lives.
About 20 to 25% of people who develop breast cancer had a prior hyperplasia. So we can prevent at least 20% of breast cancers by using this test as a guide to identify high-risk patients.
And talk to us about this test. I mean, how does one get this test?
Okay, they would have had a biopsy done.
Okay.
And the biopsy sample is sitting in the pathology division. There is no need for any new testing from the patient.
Okay.
And the pathologist will send us the sample, that biopsied sample, and we will look for cancer markers in the tissue.
Okay.
And based on the markers, we give them a score. 0 to 10. Higher the score, higher the risk of developing breast cancer. Those women who have higher than 5, 6 are about 90% likely to develop cancer.
And so once you know that, then doctors can then start to kind of
treat them,
create preventative measures.
Yes, exactly.
Because you don't then technically have cancer, the breast cancer, right?
That's right.
No.
This is before. So a woman who is diagnosed with breast hyperplasia is at an elevated risk.
Oh, okay.
And in particular, there's two different types of hyperplasia. One of them is atypical hyperplasia, and that's 1 in 5 women who are diagnosed with atypical hyperplasia are at risk for developing cancer. The other is called a usual, or a hyperplasia without atypia, and they're in 1 in 10 risk. So who are the ones that are at? We will I guess concentrate and really identify those women who are at that risk. They get targeted with the therapy, and the women who are at very low risk not to get the preventative therapy. So.
How long has this been out, this test?
We have just introduced into the market.
Okay.
2 months back.
And what have you seen so far? What have the, either the feedback from patients? Talk to us a little bit about that.
Oh, the physicians and patients are very excited about this test.
Of course.
But it's just a beginning. It's just the beginning.
And what do you think kind of comes after this? I mean, what are some of the things that you guys hope to see within your careers as far as breast cancer prevention, treatment?
Well, let's see a lower incidence of breast cancer developing. We get more effective preventive therapies. And so one of the big missions in medicine is early detection and prevention. So we are really fulfilling that mission by developing this test. And this can be expanded to other cancer types as well. So
that's
anytime
really...
where there's pre-cancer, many different cancer types have a pre-cancer before the cancer occurs.
So for people maybe that are at home that have been, I guess, diagnosed with hyperplasia, is this something that they should probably bring up with their physician?
Yes, please get tested. And if you are at high risk, please get treated. So you don't have to suffer and go through all the suffering associated with breast cancer.
Well, this really is remarkable, a breakthrough test here. Thank you guys for bringing this to us. For people that are watching also that want more information, how do they go about finding that?
They can go to our website, breasthyperplasiacancerrisk.com.
Wonderful. Again, thank you both so much for your time and for bringing us this, and hopefully we'll all continue to save more lives in the future.
Thank you so
Great.
much.
Thank
Thank you
you
so much.
All right, we'll have more of Let's Talk Live after the break. Stay with us.